Hi guys, Jack Seeley here from Seeley Chiropractic. So a lot of you guys reached out and asked for some information about disc problems, particularly lower back disc issues. So I wanted to put together a little video just to try and give you some more information about it. It's a very complex subject. There's a lot of things that I could go over, so I might need to do some different videos, different educational videos to help you with the different aspects of that. But we can concentrate maybe on a few things in this video, such as what causes it, and then in maybe some future videos, if you like this type of content, I can talk about, like what you can do to help it, and also like different phases of disc problems. You have like acute disc issues, which means it's kind of just happened, or more chronic disc issue, which means it's happened over a long period of time, and it's something that frequently gets flared up and irritated. So if we concentrate now on this video about what causes disc problems typically within the spine, and we go specifically more for the lower back, okay? And let me know if you have any questions or comments about these videos, if it's been helpful, and if you'd like me to do more of this type of thing in the future. Okay, so briefly to go over the anatomy, we've got some good models here. I have this one, and I have the full spine model that I can explain to you as well. So if you look at this one, hopefully you can see this fairly well on the camera. This is an example of two bones of the lower back, the lumbar spine. So you have the bone, the disc, the red bit, and then the bone. And then from the back, you have the spinous process, the pointy bits, and the transverse processes here. But basically, the pointy bit here is the bit that sticks out in the back of the spine that you can feel. So that would be the front of the spine. So from the side, it would be like this in your lower back. Okay, so with the disc, like on a magnet image, the magnetic convulse that you saw on my feed the other day, the person had a disc prolapse coming back, and commonly the disc comes back and laterally, back and sideways. So the example of what actually happens would be the disc bursting through like this, and it can cause pressure on this thing, which is the spinal nerve. So any type of pushing back of the disc creates a compression of this nerve, and then that can lead to symptoms depending on where that nerve goes, for example. So in the lower back, the nerves go into the leg, so that's why very often you'll get a pain response or a symptomatic response into the leg with pressure in here. So basically I've got a few notes, so I just want to make sure I'm going through everything that I I've wrote down here. So what causes it? So typically what I find with people who have disc prolapses is a few different things. One is that their structure, so their spine itself, the bones itself, are not moving correctly. So they can be very stiff in those areas, and the spine can be a different shape to what it should be. So for example, with the shape, the spine in the lower back should have this nice curve in here, lordosis. So this is the back, this is the front. So when you have the curve, this allows the weight of the body to pass through these joints, in and out through the legs and into the ground. So you get a nice transfer of weight through the spine. People with disc problems very often in the lower back will tend to have a straightening of their spine, and in some cases they can even have too much flexion, so it curves too much. So what that will do when it straightens and curves too much is it puts too much pressure then on the front of the disc. So instead of a weight and the pressure transferring through the joint and into the muscles and out through down the legs, it will go into the spine, into the disc, and create stress. And stress is the general concept for why these things happen. But the stress would be, for a disc issue, something we'd call micro traumas. So you have this constant stress going through the disc from the body being imbalanced and not moving correctly, and then the integrity of the disc, so the actual fibers around the outside of the disc start to wear and they can start to break down. So it makes the disc itself weaker. And then you can get the prolapse happening because you've lost the structural integrity, the strength of that disc. So then you can get different types of prolapses. You can just get a break of that. It's called annulus fibrosis, the material around the disc. You can get a break of that, which can create pain, or you can get an actual pushing through the disc, like on here, pushing through the disc onto the nerve, which is a full prolapse, creating pressure on the nerve, which leads to the symptoms, for example, into the leg. Yeah. So in summary, what I tend to find with people who have got the disc problems is that a structure of the spine is not moving correctly and in the wrong position. So quite often a straightening of their spine, and also from the pelvis position in here and the lantior in Finnish, the pelvis will be out of balance. So instead of having a nice horizontal line from this iliac crest to this iliac crest, what I tend to find with people is that you're going to be twisted. So one side is going to be higher, and you might also have a lot of rotation through the spine. And what that will do is it's going to put, again, a lot more stress and loading onto the discs. And the thing with stress is that the body can tolerate low levels of stress for a longer period of time, for example, or low level of stress for a short period of time. But if you have a low level of stress over a long period of time, then you're going to get this degeneration, breakdown of the disc. Okay, so that would be, for example, people who sit poorly for long periods of time through the day. And sitting poorly would be typically that slumped, slouched posture, which again is putting all the pressure on the lower back in the discs. Okay. Or people, for example, who have a job where they're having to flex and bend and pick things up regularly from that sort of position. So, cleaners, builders, people who work in agriculture, picking berries, that type of thing. Very, very common that you're going to put a lot of strain on the lower discs because of that. Okay. So this is going to be a general overview of what causes the disc problems. So again, in summary, what I find with people who have got a disc issue is that they have a structural change within their spine, so a straightening, a stiffness within the joints of the spine, they're not moving correctly, and imbalance through their body, so twisting of the pelvis. And then obviously from a muscular perspective, they will have muscular weakness within this area through here. So for example, core muscles will not be strong enough, glute muscles will not be strong enough, and the hip stabilizer muscles won't be strong enough. So that again will all lead to more stress through the spine through poor posture. Okay, so maybe this is a good time to stop the video and let you digest those thoughts on what causes a lower back lumbar disc issue. And if you have any questions specifically on the stuff that I've gone over, feel free, you can write it in the comments or send me a DM, direct message, and let me know if it's helpful. I'm not doing this for myself, I'm doing this for you guys to hopefully give you more information and empower yourself to understand what's going on with your body and the mechanisms of why that happens. Okay, so I'll leave it there and I'll come back in another video to explain a little bit more about what you can do yourself to help with the healing of these problems. Okay, so hope it's been helpful and see you around.